Thank you for the opportunity to present our work funded by NASA Hindcast, examining weather, climate, pollen, and health. We're going to give you a penultimate progress report. We are 4 years into our work. We have requested a no-cost extension to complete things. You'll learn more about that toward the end of the presentation. My name is Jeremy Hess. I'm the principal investigator on the project. I'm a professor of environmental and occupational health sciences, emergency medicine, and global health at the University of Washington. My co-presenter is Dr. Fiona Lowe. She was getting her PhD on this project and has since been granted her degree. We're very excited. She is with the Department of Atmospheric Sciences at the University of Washington. I'm going to introduce the work and then hand things over to Fiona, and she will discuss many of the findings. So I'm going to start by talking out a little bit about why allergic disease is an important issue. We have seen that throughout the world, pollen exposure is a significant issue. Allergies are a growing public health concern worldwide. Allergic rhinitis and allergic asthma are the main health impacts of pollen exposure, and the prevalence of those two conditions combined is estimated to be between 10 and 30%. And allergic asthma, which is the more dangerous of the two, prevalence is roughly 5 to 10%. This is a challenging area medically and in terms of public health. It imposes a substantial disease burden, a lot of presenteeism and absenteeism, up to 3.5 million lost work days and 2 million lost school days a year from allergic rhinitis in the US alone. We also see substantial impacts on health-related quality of life and significant costs related to medicines and lost productivity in the United States. That the last estimate was from 2004, but if you adjust for inflation, the costs are quite significant, somewhere between $4 and $7 billion a year in the United States. There are many opportunities for better management. We know that allergic rhinitis and allergic asthma are seasonal diseases. And there's an opportunity to modify people's behavior so they're not exposed to pollen. There are several different medications that people can take to reduce the symptoms and limit health impacts, but they of course have to be timed appropriately. And there are several ways that we can improve our epidemiological surveillance of both pollen exposures and of symptoms. However, data limitations are a really significant impediment to mounting all of these responses. We only have a few ground observations of pollen, and they're expensive. They require specialized equipment and trained pollen identifiers. And right now, there's no funding for pollen observations. Allergy clinics take on this responsibility themselves. They collect data and identify the pollen and then share the information with researchers. And it's quite a burden. Because of this, we were hopeful that remote data collection would be a nice adjunct and extend the ground observations and allow for more effective prevention and management. The reasons for this are that there's quite a bit of experience with observing plant phenology remotely using multiple vegetation indicators. There are also several precedents for linking plant physiology and phenology with different weather variables, particularly precipitation and temperature, and those can all be remotely observed as well. And there's several other data streams that have more complete coverage, particularly web searches, that can be linked up with these other remote observations that potentially can expand the universe of observations and improve management and response as well. We know that historically we see a very strong correlation between temperature, pollen count, and symptoms of allergies in susceptible individuals, as indicated here. And we know from observations, one of which was recorded here during our study period in Seattle, that temperature and weather conditions have a significant impact on pollen. This is a juniper outside of the Department of Atmospheric Sciences in Seattle in March of 2019. It was a warm, windy day, and you can clearly see clouds of pollen wafting out, demonstrating the impact of weather variables on pollen distribution. We also know that the specifics of the different pollen exposures in a region matter a lot. When people are young and they're exposed to different pollens, then they develop sensitivities, and those sensitivities play out as allergic rhinitis and allergic asthma in later years. However, we don't have a lot of very precise information about particular pollen species in particular locations. Pollen calendars, as you can see here, are pretty imprecise. And allergists tend to look at trees, grasses, and weeds, and the exposure periods for these vary significantly by location and are in need of some refinement. So all of this leads to the goals for our work. We partnered with the National Allergy Bureau to obtain pollen observations and perform updated descriptive analyses. You'll hear more about this in a moment. The heart of our work was taking those descriptive analyses and examining associations with various potential data streams, including phenological observations from the National Phenology Network, web searches from Google Trends, and associations with remotely observed data, including vegetation indices and weather and climate data. We also partnered with CDC to examine impacts associating pollen in different categories with various health outcomes. And all of this went into work to model pollen counts by taxa and estimate those counts both historically and in the future. Some of these efforts were more successful than others. We're going to highlight the successes here. Now I'm going to turn it over to Dr. Lowe to describe some of the analyses that we conducted.
Thanks, Jeremy. So the goal of a lot of this project was to understand pollen and be able to use this for the treatment of allergies. So allergies can't be cured, but they can be treated successfully with medication, exposure reduction, and immune therapy. So we focused on specifically medication exposure reduction because a lot of medications take 2 weeks to be fully effective. And if we can predict when the beginning of the pollen season occurs, you can take medication before you actually get symptoms. And in addition, to reduce pollen exposure, if you can make a forecast a couple of days ahead of when a high pollen day will occur, then people can make preparations to avoid exposure to the pollen. So next slide, please. We received our data from the National Allergy Bureau. They gave us, there's about 63 stations. Next. And unfortunately, the spatial resolution of these stations is rather sparse. Many states don't have even one station in them. And then for some of the stations, we do have a sampling issue in that some of the stations you can see on the right, here's an example of one in Silver Spring, Maryland, is that they take data mainly on weekends. Next. So as Jeremy said earlier, there are some pollen calendars for the US, but surprisingly, we found that there was actually no standard pollen calendar for the US. And so we thought it was important to create these because it's important to understand where, when, and how much pollen there is in the atmosphere. So the pollen calendar is the average pollen concentration for each day of the year. It shows, and here is an example of one for Seattle, Washington, and that shows the seasonality for each pollen type. So you can see in Seattle which pollen types occur here, which ones are the most abundant, and when they occur, what time of year they are most likely to be found. And you can see there's a grayed out region in October, November, December. This is because Seattle doesn't collect pollen in the winter. And unfortunately, this is fairly common also for some of the northern stations, that they do not collect data in the winter. This is one of our most requested visualizations. So we plan on sending this and some summaries to our stakeholders and some of the NAB stations. Next, please. We also developed some pollen calendars by pollen type. So this is for oak pollen. And you can see on the y-axis, these are the stations in the US, and they're ordered by latitude. And you can see that the pollen season starts in the south and moves northward throughout the spring. And from this pollen season, we can define the start date, the end date, and through that, the pollen season duration. And we can also define the peak date at which you have the peak pollen date, also the peak amount, and total seasonal amount. So in the next slide, I'll show you a summary, and this shows you the relationship between the pollen season start date, duration, and latitude. So here, if you look at in the x-axis, we have the start date, y-axis, you have the duration of the pollen season, and you can see that the earlier start dates, for stations with earlier start dates, they have a longer pollen season. And then if you look at the colors of the circles, where the lower latitudes are redder, you can see that the earlier start dates occur at lower latitude stations. And although this is an example of oak pollen, we can see a similar relationship for other trees and other grass pollens. So we analyzed the start of the pollen season because this is important for allergy sufferers to be able to take medications before they get symptoms. And we found that the start date is different for every year. So this interannual variability is shown here in this figure, where different colors show different pollen types. And there's a significant interannual variability, and it depends on the pollen type, and it can range between 8 and 32 days. And you can see here that missing data can be a problem for a few pollen types that release pollen early in the year, because some of the stations start collecting pollen too late and miss the start of the pollen season. Next, please. So one method for us to increase the pollen data is to use internet searches. So we use this as a proxy we use Google Trends as a proxy for pollen concentration. So Google Trends tracks the number of searches for a particular term. Here's an example of the number of people searching for the term pollen in Washington State over 5 years. And you can see that there's a seasonality in the search volume, and it looks a little like the pollen season. So this data is available publicly, and it's available for metro areas in the US. Next, please. And we found that internet search data is correlated with the total pollen concentration at some stations and at some years. We have strong correlations, and for example, we have a strong correlation at Washington, D.C. in the left-hand figure, where you see the internet searches in blue and the observed pollen in red. But then in the right figure, in Oklahoma City, you see that there is not very good correlation. And we found that the correlation is strong when the search volume is high. So this is essentially when there's a large local population with a lot of media use. And the correlation is also strong when there's a strong signal of the pollen peak. So if the pollen concentration is low, not many people will be Googling the term pollen. So this is really great because this Google Trends data can be used to supplement our pollen observations where we have insufficient location or timing of the pollen observations. Next, please. So the next, I'm sorry. Go ahead, Jeremy. This is your section.
Thanks, Fiona. So we partnered with our colleagues at CDC to extend our analyses to examine health impacts. And the reason we did this is that while there has been some research on pollen and its various health impacts in the past, the information that we had prior to this work was limited and potentially confounded. Previous work had not looked at specific categories of pollen. Allergists tend to think of pollen and tend to group pollen in terms of trees, weeds, and grasses. And prior analyses had not grouped specific pollens in that way. Also, confounding or potential confounding with influenza-like illnesses and air pollution had not been considered. So we developed some additional analyses in collaboration with partners at CDC. These analyses were retrospective using our pollen data, grouped according to those three categories. And we looked at impacts on medication refills, outpatient clinic visits, emergency department visits, and controlled for air pollution and influenza-like illness, and specifically controlled for small particles, PM2.5, and for ozone. We looked at the season start. We used a very sensitive definition of season start date when the cumulative measure of pollen crossed the threshold of 50 grains per meter cubed, or if that wasn't available, then we looked at 2.5% of the season's total pollen count. We linked each metropolitan statistical area with data from the NAB, and then controlled for air pollution as noted. And we developed generalized estimating equations and conducted a meta-analysis of the city-specific analyses to generate estimates, and stratified the observations by age. And we have finished these analyses and submitted them for publication. They're currently under review. The findings that we have, which we presented at the Quad AI conference about a year ago, show that trees are the most allergenic, and there's a relative risk there of roughly 1.2 for high exposure to tree pollen relative to low exposure days. Weeds are the next most allergenic with a relative risk of about 1.1, and then grass pollen actually did not reach significance for overall risk in the meta-analysis. You can see there's significant geographic variation for each of these different categories. We found that there was not much confounding from air pollution or influenza-like illness. We suspect that the variation you see across the different sites relates to the differences in which pollens are included in each category. Not all tree pollens are equally allergenic. For instance, oak and juniper are particularly allergenic, so places that have a lot of those trees will likely show stronger relationships. Same thing for weeds. Ragweed is particularly allergenic, but not in all locations. So some locations without significant ragweed component are probably not showing a strong relationship with weed pollen. We also stratified by age. We were curious to see how these relationships played out in a pediatric population and in adults. And as expected, we saw a stronger association for pediatric patients, relative risk roughly of 1.3 grouped for the entire analysis. For older adults, we saw a relative risk just under 1.2. And this is consistent with what has been observed in the literature, that sensitivity to pollen exposure tends to grow over the course of childhood from 5 up to about age 20, and then it starts to drop off a little bit. Though people who have allergic disease tend to have those allergies and be plagued by them throughout the life course. Next, I'm going to hand it back over to Fiona to talk about modeling.
Thanks, Jeremy. So the present state of modeling pollen, the present state of forecasting pollen is not so transparent. This is pollen.com on the internet, and maybe some of their forecast is just from clicking it out myself is maybe not so great. So we've tried to come up with a transparent scientific way of modeling the pollen. So next slide, please. So this is really important because we want to forecast pollen as an early warning for allergy management, so people can prepare and make plans to minimize their allergy symptoms. And we want to also increase the spatial temporal resolution by filling in times where there's no pollen collection or locations with no pollen stations. Next, please. So to develop the model, we included environmental variables as predictors. So environmental variables that affect the amount of pollen in the air. And they do this two ways. The first way is they affect the plant development and contribute to its readiness to flower. These are things such as the temperature, water, and sun. And the vegetation indices show us greening in plants, and they are very good at indicating the timing of plant development. Next, please. And once a plant is ready to flower, the environmental variables that affect the amount of pollen in the atmosphere, such as temperature, humidity, wind, solar radiation, and precipitation, these affect how much pollen gets released into the air and how long it remains in the air. So next, please. So we developed a machine learning random forest model to predict pollen. This random forest model is particularly good at predicting complex nonlinear processes, such as the pollen system. And in particular, random forest can handle a lot of variables as predictors. So we threw in a lot of variables into this model. And this is a definite advantage over traditional regression models. So next, please. I'll show you what this model of a daily pollen concentration looks like. So here is a model of the oak pollen, and you can see that the oak pollen begins in the south and then travels northward. And then you might even be able to see a west to east propagation of the pollen, and this is due to the weather systems moving from west to east. Next. So from this model of daily pollen concentrations, we can actually predict a couple important things for allergy sufferers. The start date of the pollen season, because many medications take a couple weeks to be effective. We've developed a 14-day forecast of the start of the pollen season. And then we can forecast high pollen concentration days so people can take action and avoid spending time outside being exposed to pollen. So we found moderate to high skill in forecasting from some pollen types. The pollen types where we did not find didn't have such good skill were ones where there was a lot of missing data associated with that pollen type. So next, I think it's up to you, Jeremy, to wrap it up.
All right, thank you. So we are interested in moving forward and developing operational models for pollen concentrations for different locations. Here you can see our model for Atlanta. We have looked at different iterations of the model that include regional weather and other remotely sensed observations, and those remotely sensed observations for the region improve the model. So we're looking to incorporate those variables and expand the coverage of the model to the continental contiguous United States going forward. The work overall, we've made good progress in a number of different areas. We've gone down several rabbit holes that turned out to be dead ends, but overall, we've got a nice catalog of work on pollen data. We've updated pollen calendars for specific sites that have been tracking pollen over time and developed national pollen calendars that are up to date through 2019. And those demonstrate that there's pollen counts continue to be a local phenomenon, strongly affected by local ecology and local weather. We've updated the publicly available catalog of pollen data and pollen calendars for the country. We've also highlighted that there's some pretty important data limitations that, if corrected, might improve pollen observations and pollen forecasting going forward. We've identified several potential remote sensing applications. While vegetation indices are important in some areas. They're of limited utility in others. And they're of limited utility for certain kinds of plants like grasses that tend to green up early and stay green over the duration of the season. We have seen that pollen has significant health impacts in the United States, and we are now more confident in the observed associations because we've conducted analyses that control for potential confounders. We see that those impacts are particularly strong for adolescents and young adults, and we know that you can observe an association between web searches for allergy and other terms and pollen, and that for markets with good internet coverage, the web searches are a nice proxy for pollen counts, and that has great potential for expanding the work we've done into areas where there are limited observations of pollen directly. And then lastly, we've demonstrated that a machine learning random forest model has markedly improved skill for forecasting pollen in certain areas and for certain taxa. We are looking forward to building on this work over the next year. As I mentioned, we have a no-cost extension, and we're going to be moving forward to take the analyses that we've done and provide analysis products back to our NAB stakeholders. We're going to be developing visualizations of station-specific pollen calendars and trends for each of our partners. We're going to be doing their reports on their data collection and gaps in data and implications for sampling strategies. We're going to expand on our health analyses. We're going to look at taxa-specific exposure outcome associations, and we're going to use the estimations of health burdens that we've developed, and using historical observations and projected weather data, we're going to try and estimate burdens of disease related to allergic rhinitis and allergic asthma for the United States historically and going forward. We're going to complete our taxa-specific modeling and generate exposure data sets for historical periods and projected through the end of the century for total pollen and also for taxa-specific pollen counts. And we're also looking into how automated pollen detectors and artificial intelligence algorithms that identify particular pollen types might facilitate ground observations and allow for more cost-efficient data collection and enhance utility of the remotely sensed observations that we used in this study. We're very grateful for all the support we've had to do this work. Thanks first and foremost to NASA for support in this effort and for flexibility as we explored lots of different possibilities in this project. We'd also like to thank the Quad AI and the National Allergy Bureau for their support of this work and for the data that allowed us to move forward. We'd like to acknowledge and thank our partners at the Centers for Disease Control and Prevention. They've been excellent and stalwart partners throughout the process, and we're looking forward to continue our work with them. And then lastly, we'd like to thank our stakeholders. Those include the Council of State and Territorial Epidemiologists, the Environmental Protection Agency, the Lancet Countdown on Health and Climate Change, and the Institute for Health Metrics and Evaluation, all of whom have collaborated with us on the core analyses and on our Tiger Team activities to examine the public health impacts of pollen and consider how those impacts may change over time and how remote sensing can be used to better estimate exposures, health impacts here in the United States and potentially in the future globally. We really appreciate your collaboration and engagement. Thank you very much. We look forward to continued partnerships. If you have questions or would like to engage further, please send us an email. My email is jjhess@uw.edu, and Dr. Lowe's is FionaLowe@uw.edu. Thanks very much.